Good afternoon, and welcome to today's webinar, Building Patient Trust Through Accreditation and Certification for Medical and Wellness Travel Programs. I am Karen Timmons, CEO of Global Healthcare Accreditation, and joining me today will be Bill Cook, Director of Business Development and Marketing at GHA, as well as Uliana Kanili, who is the local representative for GHA in Bulgaria in the region, and also currently serves as CEO of MediHealth. We are very excited to present this webinar to you today. Bill and I had the opportunity to visit Bulgaria several years ago and to visit some of your beautiful locations as well as your clinics and hospitals in the area. And we know how appealing Bulgaria is with many its natural resources with respect to spas and well-known centers. So we're very excited about the opportunity to talk about wellness and the wellness hotel program that might be of interest here in Bulgaria. I would like to ask Bill to introduce himself, and then Uliana will also speak a few words. Bill?
Thank you, Karen. Good afternoon, everyone. It's a pleasure for me as well. As Karen mentioned, we had the opportunity to visit, I think, in June of 2019. So it was really, a great opportunity to see the area, the country, some of the facilities. We had the privilege of visiting some of the beautiful locations. So it's a pleasure being here with you, and hopefully we can provide some value here and talking about some of the value of accreditation certification for healthcare providers as well as wellness hotels. So my background, I'm the Director of Business Development and Marketing for GHA. And I've been working in medical travel for about 15 years, with GHA about 4 years. So thank you again. And Uliana, please go ahead.
Hello, everybody. So nice to be on such an interesting panel. I think everybody would be interested to listen, to see what kind of presentations Karen has prepared for us. Very briefly about myself, since 2019, I became part of the MediHealth International. That's a non-governmental organization which is committed to support national and international healthcare endeavors, to provide assistance to healthcare providers, buyers and sellers. And one of our major role we see and we emphasize on is to build up partnerships, to educate the healthcare, welfare, wellness industry players, patients, agents, etc., to feature new products, technologies, and services, and to join efforts with national and international partners in reduction of economic and social disparities, utilizing grant programs and financial mechanisms. One thing I'm very proud of is my sort of interest in organizing workshops, because I deeply believe in this type of form as a form to launch, to introduce new product, to invite speakers, guest speakers from reputable organizations. And that is what happened in 2016 when we had the first workshop on certified medical tourism professionals. At that time, it was organized by the Medical Tourism Association, which is linked and correlated with the Global Healthcare Accreditation. And after that, in 2019, there was a workshop organized on Global Healthcare Accreditation. Shortly after that, we were happy to bring to the program two of our Bulgarian end users and customers, which hopefully when the pandemic relieves, hopefully will have a real chance to complete their project with live presentation from Karen or Bill or anyone from Global Healthcare Accreditation. Now, okay, back to you, Karen.
Okay. Well, we feel very fortunate, Uliana, to have you as a local representative in Bulgaria. It helps GHA understand the local issues that are going on, as well as certainly to have local representation so that organizations and individuals can go to you for some potential questions and assistance as they might need it. Would you like to talk a little bit about the Latvia Health Tourism Cluster?
Yeah, thank you. Latvia Health Tourism Cluster, we recently established partnership relations, and we sort of completed a formal partnership agreement with them for many reasons. First of all, because that was the first sort of institution which responded to our request for partners. And the request for partners was sent through the organization which is called Enterprise Europe Network. I'll talk about that in the next slide. But Latvia was the first institution which responded, and they responded very reasonably. As you see, it is really a tourism cluster, but they have lots of subject topics that are part of our global healthcare accreditation and medical travel care continuum. I'm very happy and very proud to sort of quote the medical travel care continuum process, and Karen will explain later on.
Yes, I will.
What is the nuance here, etc. And we see the Latvia cluster. They are more or less covering the medical travel care continuum, but I would be very happy if through our partnership, we can contribute to bringing them on a higher level by means of accreditation, by means of certification, with only one basic consideration. That will help them increase the visibility, increase their quality of work, and recognition among other international partners.
Okay, thank you. Bill, I think we have lost the presentation. I don't know if you can share.
Okay, yeah, I thought it was on. Let me yeah.
If not, I could.
Okay, yeah, it's supposed to be. 1 second here. Let me get.
Maybe I could talk a little bit. Oh, he has started. Here we are. Okay.
Here we go. Let me just.
If I may add one more thing, our colleagues, the colleagues from the Latvia Health Tourism Cluster, they presented a very nice, very well presented video on their cluster. So it is the link is on the slide, which speaks about Latvia Health Tourism Cluster, and everyone is welcome to visit it. And later on, of course, hopefully, will to extend questions, answers, comments, proposals, etc., etc. This is the main reason for us being together. Thank you,
Leon. Next slide, Bill. First, I do want to mention at the bottom of the screen, if you hover, you will see that you have the opportunity to ask questions, and there's a chat box. So please don't hesitate to write in a question, and we will respond to your questions at the end of the webinar. So our focus is exclusively on medical and wellness travel. We have developed our standards in consultation with numerous experts from both fields, and we really want to work very hard in supporting healthcare and hospitality providers, help validate their quality, help assure confidence and trust on the part of either guests or patients. And we want to help them have a very sustainable, successful business model going forward. Our services include accreditation, certification, training, and advisory services for hospitals, ambulatory centers, hotels, and individuals, and we'll be talking about some of them today. Next slide. Our standards were accredited by ISQA, which is the International Society for Quality. In many ways, it's the accreditor of accreditors, so that we are able to walk in the shoes of our clients and understand what it is to comply with standards and expectations. And it's a very professional organization, and we are very happy to have that representation of accreditation by ISQA. Next slide. We'll be talking about medical wellness and medical travel. We define, GHA has adopted the Medical Tourism Association definition of medical travel, and many people call it medical tourism. There are certainly different words or phrases that are used to describe it, but for our purposes, we do talk about medical travel because it's a specific focus that the patient has, traveling outside of their local area of residence for the specific purpose of receiving medical services. And patients travel for numerous reasons. Obviously, patients here in the United States will travel abroad because the cost of care here is so expensive, and if they do not have adequate insurance, certainly they need to travel abroad to get that care. Patients in Canada or the UK, for example, might travel because they have, while their care is paid for, they might have to wait several years in order to have access to that care. So they're looking for quicker access. Other patients might be looking for higher quality or technology that's not available or treatment that's not available in their home country. And as they're looking as to where they should go for travel, they have a perception of that destination, and safety plays a very big part in that. They want to make sure that the country, the region that they select, and the organization will have their back in regards to safety, and that they will feel comfortable in that location. And that together equals the value. So there is value for patients in traveling. Drivers of medical travel, obviously there's been an aging population, which has a concomitant increase in degenerative diseases. So there's more folks might need hip replacements or knee replacements. Dentistry is usually not included as under coverage for insurance. So it's an out-of-pocket expense and can be very expensive. And so folks might look for lower cost options for dentistry work. Folks might be looking for more innovative, less invasive technology. The growth of the middle class in countries such as India and China has spurred also travel from those countries looking for higher quality, or obviously the reasons that we've noted above, technology. And prior to COVID-19, certainly citizens from all over the globe were feeling much more ease of travel and infrastructure. Most areas had good transportation, had good airports, and people were used to traveling. It was very common, and better access to information with the advent of the smartphone and digitized communication. Most citizens are used to, searching online, and therefore there was much more information available to patients as far as options with respect to their own personal care. In some parts of the country, such as the Middle East, there's a global healthcare shortage. So patients needing specialized services from those areas might be traveling outside of the Middle East to other locations. And again, I think this point prior to COVID-19, there was increased disposable income, more access to credit services, and some patients would be traveling due to instability within their home region. So travel associated with the pursuit of maintaining or enhancing one's personal well-being. Certainly post-COVID, this is a very important motivator. People are more focused on their well-being. They want to stay healthy. They want to sustain their health. And so wellness tourism is expected to be very popular and to grow in the next few years. The next slide, please. Some of the drivers: return to everyday life, feeling rejuvenated, escape the demands of everyday life, experience activities outdoors, to be able to look and feel better, connect with nature, and find peace and quiet. So there's various factors. This survey was done in July of 2020, so right during the pandemic. And certainly, I think we all can relate to the need to escape from the demands of everyday life and the need to feel rejuvenated. So let's compare the medical travel. When we talk about medical travel, we're talking about individuals traveling in order to receive a treatment or illness oriented. So it's really related to their personal health. Wellness tourism is wellness oriented with an emphasis on promoting one's health and preventing disease or from happening. So in contrast to medical travel, wellness is very proactive, whereas seeking a treatment for something is usually reactive. I think that's pretty obvious here. Okay, next slide. The unique intersections of medical travel and wellness, certainly both require logistics. You need an itinerary, you're trying to plan as far as where will you get the best, whether it's spa treatments, meditation, whether you're going for nutritional counseling, for healthcare, where are you going for your treatments? But they both overlap when you're planning an itinerary, you're planning the course of treatments or options that you will have for wellness. If you're traveling outside of one's country, there's the choosing of that destination, wanting to make sure that someone will speak your language, wanting to have a good experience, have good customer service, and whether it's a patient experience or a guest experience, you expect quality with respect to that. So there are some commonalities when one is talking about medical travel or wellness travel. In Bulgaria, you're very fortunate, I think, with your environment and certainly the number of local resources and spas that you have, which really exude wellness. The Ministry of Health in 2018 had noted that there were 47,500 medical tourists to Bulgaria. And the Bulgarian government has made tourism a national priority, seeking both medical and wellness tourists. Some of the focus with respect to medical travel has been on cosmetic or dental treatments. And there certainly is a good opportunity to leverage medical centers, given the natural resources of Bulgaria and the spa resources in Bulgaria, which would provide very suitable combination of surgical procedures and then subsequent recovery and rehab in a very nice spa setting. With lower costs being an advantage, Bulgaria also has the potential to become a leading destination with efforts to leverage accreditation, certification, public-private partnerships, and the existing infrastructure. And Uliana, would you like to comment on the opportunities available in Bulgaria with respect to whether it's medical or wellness travel?
I don't know, first of all, do you hear me?
Yes.
Oh, okay, good. Because what I see on my screen, it is just myself, but I heard you, Karen. Okay, the health tourism in Bulgaria has always been on the radar screen of the Ministry of Health and on the Ministry of Tourism mainly. Both ministries, especially the Ministry of Tourism and other non-governmental organizations, are trying to find the best solution in the changing environment. And the major problematic thinking right now is how to better utilize existing capacity in terms of hotels, in terms of personnel, because there are really very good hotels, there are very well educated, skillful medical staff. And so what they're trying to do is they're trying to improve visibility, to become better recognizable on the international market, to find their international partners, regardless of the markets. And you, Karen, mentioned very well the Middle East markets. So maybe even the Far East markets are interesting to look at. So Ministry of Tourism is doing their best to improve the legislation, to improve the partnership opportunities, to improve the existing structures, to make it more compatible, to make it more flexible, to provide opportunity to work those hotels and spa centers, to work on 24 hours, 12 months, a year. And I think they will find their way. So the ministry is adding up to existing programs, many other programs like herbal, wine, horseback riding, actually, mineral water that is traditional everywhere to be found, caves explorations. The good thing is that, yes, the government is thinking, private entrepreneurs are thinking, they are not just sitting and waiting, and they are more or less pushing forward any other institutions and all institutions that are involved.
Well, thank you, Juliana, for that unique perspective. And certainly I think there are major opportunities ahead for Bulgaria, building on and leveraging some of the unique aspects that you mentioned. So thank you for that input. One aspect of medical travel that is very different when you look at just the healthcare system within a country is that it really relies on multiple diverse stakeholders. You're talking about not just the usual aspects within the Ministry of Health, investment, so financial markets are involved in investing in medical tourism because it can be expensive to initiate. Getting all of the stakeholder associations, the professional associations, which includes not just the healthcare, but the tourism, making sure the Ministry of Tourism, the hospitality associations, the hospital associations, the professional doctor associations, all of those supporting sectors are involved and aware of the need to build this destination. Government plays an important role, obviously, with the Ministry of Health, the Ministry of Tourism, the Ministry of Economic Development, all need to be working together and have a common vision as to what medical travel will be within that country. And when one thinks of a financial destination, such as potentially London or New York, one is not thinking of just one financial institution, or when one thinks of IT or technology, they're not thinking just within Silicon Valley of just one organization. Usually there's a cluster of organizations that exist in order to make that destination very well known. So sometimes it's very important for what might seem to be competitor organizations to really work together to make sure that they have differentiating factors that can lead to a very robust medical travel destination, and including and working with all of these diverse stakeholders is very important. So hotels, tourism, travel agents, restaurants, all of that provide a major infrastructure for both, not just medical travel, but also for wellness as well. And obviously healthcare is at the center of medical travel, but then trying to get insurers, employers, government also aware, as Uliana mentioned, the Middle East, you might have to visit the Middle East, talk to some of their ministries of health or the regulators in order to have them refer patients to Bulgaria is certainly one way to work together. And then obviously patient, how are you making yourselves, your brand prevalent among patients who might be interested in coming, and making sure that the treatments and the specialty areas of treatment within Bulgaria are very evident on the websites, et cetera, and marketing efforts. So there's quite a few stakeholders that should be involved in this effort working together in order to obtain that end result of Bulgaria as a leading medical travel destination. So the key elements, and I mentioned some of them, you need governmental support, and whether it can be just even for airports that they have, visas and they have a holding area to receive medical travel patients who might be coming. Public-private partnerships are very important. We mentioned the importance of tourism, and to have, especially in a place like Bulgaria that has the existing natural resources and spa treatments, in order to play that together and leverage both the medical travel and the wellness as a package. Human resources training in order to talk about appropriate cultural competencies that might be necessary in order to take care of guests and patients and make sure that they have a very good experience, making sure you have the resources for language and respect for different cultures. Having accreditations and certifications is very important so that you're building the trust and the confidence of patients in your organizations, and certainly marketing and promotion, your websites. All of those are very, very important as you're planning a successful medical travel destination program. Pre-COVID, the projections called for a 25% increase in medical travel each year for the next 10 years. Now, obviously, during the past year, everything halted, not just in Europe or the United States, but around the globe. But things are reopening now, and knowledgeable patients are demanding more data in making decisions about their care. We talked about the advent of the smartphone and the capabilities that brings to citizens as, needing more information and wanting more information and taking control of making decisions on their healthcare. And the wellness tourism market also is poised to grow by $315 billion during 2020 and 2024. Now this, obviously, even the wellness, COVID has really leveraged individuals into wanting to be much more involved in their own care, and wellness is certainly a high priority moving forward because people want to sustain their health and be prepared for the next coronavirus, and really are taking this to be a very personal journey on wellness. So building patient and guest trust. Bill, you're going to take over on this?
Yes.
Turn it over to Bill.
Yeah, thank you, Karen. So just moving a little bit, shifting a little bit now, looking at the current landscape, and I don't have to go into a lot of detail here. I think everybody pretty much around the world, has obviously seen what's happening with COVID, how it's transformed the life of all of us as we know it. Healthcare provision, travel, the economy, social norms, all of these things have changed, drastically since, early last year. So obviously medical travel programs and hospitality providers, businesses, have been significantly impacted. And GHA, we've been in touch with a lot of these programs, a lot of, especially healthcare providers, but now as well now starting to work with hotels and others, seeing what the challenges are and working with them and new services that we can offer and products. Some programs we've seen have been impacted more than others. There's some that have obviously had to cancel elective procedures in order to have more bed capacity or to mitigate the spread of the virus. We've seen others that have had to shut down, talking about, either healthcare providers and sure possibly some hotels, or reduce, number of staff. Many hotels have had to do that. But, things are changing. While the situation is still uncertain, there's vaccines now coming. Some places are opening more than others. Right at the moment, I think looking at the news, have been kind of cases. A lot of places are starting to go down. We don't know if that's a long-term trend or not. But just doing some research, I've seen just looking at the UK is now vaccinated. I think one of the over 15 million people. Denmark has announced plans to launch a coronavirus digital passport by the end of this month. Countries such as in Europe or Cyprus, Iceland, Estonia, Georgia have eliminated restrictions for travelers who do have evidence that they've been vaccinated. And so, a lot of changes are happening. Hopefully positive changes little by little, but there is that everybody's talking about that new normal, and I think we're little by little, we're finding out what that is. And so we must make, as a medical, whether you're a medical organization, a clinic, hospital, or you're a hotel and working in hospitality, we must make really intentional decisions now and take deliberate actions to really support sustainable recovery now as we move hopefully into a new normal as travel restrictions begin to lift. So mitigating risks as you move to the new normal in medical and wellness travel. I think this is a good quote here. Ability to deal with a crisis is largely dependent upon the structure, policies, and protocols that have been developed before the chaos, hopefully before the chaos. You don't want to wait till a crisis is upon you. But if you're looking now, obviously, a lot of people or organizations did not expect, the impact that this COVID-19 had, but you're looking at now airlines, you're looking at hotels, healthcare providers, they're implementing new safety protocols. You see things in the news with new partnerships on sanitation and cleaning, testing, and different things like that. So this is what's going on now. And so organizations, whether you're a clinic, whether you're a hotel, really have to have these protocols in place. If not, really, most guests or patients aren't going to travel if they don't feel you're addressing these risks. Safety, and I think most would agree, will likely, and I think is right now, becoming a brand differentiator. This is from a leading expert in this area, Jenny Blumenthal. Brand loyalty will likely hinge on safety above all else, a factor consumers will likely prioritize well into the recovery. So why are so many business focused on safety and promoting their safety protocols and sanitation? Because I think it's already a brand differentiator. People are already seeing that and really starting to promote that, as I mentioned, through the protocols they have in place, sanitation, cleaning, infection prevention, what they're doing, screening patients or guests coming in. So this is something organizations that want to have sustainable programs and services long-term, must do. Consumers are seeking trusted sources. This is a survey that was done by Pricewaterhouse recently in 2020. They asked, who do you find to be the leading authority on what defines safety when it comes to traveling in the context of COVID-19? And people are looking for trusted sources, such as the World Health Organization. You see on the right there, CDC, maybe looking at state government, other healthcare organizations. So they're really, consumers are putting their faith and trust in and equating brand trust with cleanliness. So really, I think cleanliness and these type of precautions may have been nice to have prior to COVID, but now they're, I think, critical selling points. If you're a hospital, if you're a clinic, if you're a hotel, you really have to show your guests, the patients that you're targeting, what you're doing to keep them safe, especially if it's a patient that's traveling or guests traveling from other countries. What's the airlines, the travel, arriving in the destination, transportation, and different things. And we'll look at that as well a little bit. Consumers want evidence of again, safety protocols. When planning, this was a question again in that survey, when planning to book your next flight, hotel, please rank the following factors based on importance to you once the social distancing recommendations are lifted. So brand trust encompasses safety and cleanliness is top of mind for patients and for consumers in general. So we really have to use every touch point, whether it's a medical travel patient, whether it's a wellness tourist, and reassuring them that your organization is safe, communicating with them frequently about your policies and protocols. So getting a little bit here and building patient guest trust through accreditation certification. Now we'll go a little bit into our programs, how we can assist organizations with that, whether it's accreditation for healthcare or whether it's for hotels. So, why does accreditation and certification matter? I think research and international opinion, for example, the World Health Organization supports the positive impact of accreditation on the quality of healthcare services. So I think people are pretty clear on that, how it helps improve safety, and in our case, the GHA really focused as well on the patient experience and business processes. So accreditation and certification issued by a recognized third party provides validation to your patients or to your guests that your organization is adhering to recognized industry best practices for safety, outcomes, and potentially get patient guest experience. Here we're looking at, in a little bit more practical, look at some examples of here, specifically GHA standards and best practices for healthcare providers. So just looking at a little bit about GHA, and this is again for healthcare providers specifically talking here, we have our, the problem really that there's really been no seal of approval for patients or buyers or payers to rely on, and a lack of, as you see here, lack of standardization and best practices and protocols for medical travel patients. You know, anyone who's been working with international or even domestic medical travel patients know there are challenges. These patients, you really have to, there's a patient experience happens before the patient arrives at the clinic or the hospital. You know, even when they on your website, looking at the information on your website, you know, the pre-arrival, post-discharge, care management, transparency, compliance, ethics, financial transactions, marketing is a lot of things that, you know, communication and education is critical, you know, before patients travel to organizations, so they're aware, you know, about the destination, about the doctor, your physicians, and things like that. So GHA standards really address these at each stage. You could look at the right here, the medical travel care continuum. So these are the touch points where the patient, you know, will be really traversing on their journey through the healthcare experience with an organization. So that's service selection, destination selection. You know, if they're looking at, they're sitting at home in their kitchen looking at the website, you know, is that website in the patient's language? Does it have the information about the services specific for medical travel patients, about the educating about the destination? Is it not only in the language, but really going even farther, localizing the website, so the images, the symbols, the colors are aligned with the patient's cultural background. If you really focus on that patient experience, that's something you can do. Information sharing and planning. How did the organization determine if the patient is a candidate for the procedure or treatment? Do they have standardized practices for screening the patient? Sharing information about informed consent, patient rights, arrival, who's picking them up, and now with COVID, and we'll go into a little bit more detail on that. You know, what protocols are in place for arrival and also for COVID and infection prevention. The hotels patients are staying at, are they aligned with the needs of patients with certain conditions, certain budgets? Do the patient staff understand the needs of the patients? Is there a liaison with the hospital or clinic? Then going through those little blue circles, which are what a typical accreditation would cover, which was admission, treatment, discharge, and then after that, accommodation, again, follow-up, departure. So our standards really address each of these touch points, helping improve that enhancing that patient experience and safety across that care continuum. Just briefly here, just our standards here. We have three main areas that our standards focused on: patient-focused clinical processes, really the care management for medical travelers, infection prevention control, quality improvement, patient safety, patient rights. These are always specific to or from the perspective of a medical travel patient. For example, infection prevention control. What is your organization doing to mitigate the risk of a patient with an infectious agent coming into your country or to your organization, which obviously is very relevant right now with COVID-19. But so we do look at some clinical standards, but they're always from the perspective of an international patient, so we're not redundant with what a more clinical accreditation might be focused on. Also, patient experience is obviously a very core part of our standards. Cultural competency, how do leadership support that, training, understanding the cultural background of your guests, the language, communication and education I mentioned, patient advocacy, assisting and supporting the patient, before, during, and after they've traveled to your facility, the physical environment, safety, travel and tourism, which is an important aspect. And then we're very unique also in that we look at sustainable business processes. So looking at, leadership, risk management, what risks that medical travel patients might have and how you're managing that, with maybe contracted providers and things like that, business ethics, financial transactions, marketing, what I mentioned, supply chain management. So our standards go into all of these areas. This is just again the medical travel care continuum. We're going to go into just a little bit, some examples, practical examples. In terms of the marketing, that service destination selection stage, the goal here is really access for the patient to detailed information on the website, social media, or other marketing channels to provide education about the organization, your services, the destination, as I mentioned, the professionals you have in your organization. So, for example, this is one of our standards, marketing one, the medical travel program or a designated department plans key policies and processes of its medical travel programs. The website language understood by target market groups. I mentioned about localization, cultural considerations appropriate to the target populations, contact methods and staff information and social media marketing materials on the website. So it's easy to contact the organization. Looking at also standards related to patient advocacy, opinion, and satisfaction data when used in your marketing materials, ensuring that they're validated, ensuring that they've been approved by, if somebody's putting a testimonial, a patient, that it's been approved for use. Care management, this is another area kind of alluded to earlier. The medical travel program has standardized processes for the collection of patient information, clinical data and information reports prior to patient travel on arrival. And we will share this video, this webinar, so you can also view this later on. So we won't go into a lot of detail, but this is during the information and sharing stage. Does the organization use checklists or other standardized methods to collect clinical data and information about the patient? Is it confidential? How are you collecting that data? Is it someone just sending that via an email, or their personal or private medical information, or is it being uploaded to a secure portal? There's certain laws in different countries regarding patient privacy, what can be done, and GDPR obviously is very strict in Europe. The patient is informed of any additional required document tests, really educating the patients, and the patient informed of any related physical and healthcare requirements associated with the plan, procedure, or treatment. So these are best practices. These are part of just a small example of our standards. Communication and education, which is very important. And the medical travel program educates patients regarding the planned care at the destination. These patients do not live near your hospital or clinic, so in advance, you really need to provide the most accurate and relevant information possible before they travel, so they can make their plans. Educate patients about their anticipated care plan and facilities where the procedure treatment will be provided. Increased risk of combining travel with surgical procedures, for example, deep vein thrombosis or other potential risks. So patients are aware of them in advance and may need medication, especially if it's after the surgery. Recommended total length of stay in the destination so they can plan their travel, detailed itinerary. So all these details patients are aware of before they travel. Travel and tourism is another standard. Ensure that the recommended transportation and accommodation options are aligned with the patient and companion's needs and expectations. So, and this is, I think, I remember speaking to a doctor once who had a patient who had a procedure done. The patient, I think it was aesthetics procedure. The patient seemed to be very happy with the procedure. The doctor always used to send out a survey afterwards just to see how satisfied the patients were with the procedure. And so he was expecting to get very high marks. I think it was like 1 to 5, 5 being excellent, and he got like a 3. So he was very puzzled and surprised why the patient seemed to have had a great outcome with the procedure. But then when he spoke to the patient mentioned, well, nobody picked me up at the airport. The hotel really wasn't what I was looking for. The staff didn't understand my needs. So really the patient had kind of a terrible experience with the hospitality part, with the hotel, with transportation and other parts separate from the healthcare. And that really impacted their whole, their perception of their whole experience. So it's important to understand it's not just what you're providing in your facility, it's also that whole care continuum. So here, I won't go into detail, but you can see some of the information that patients should be aware of in terms of helping them make their travel arrangements, treatment schedule, and different things like that. Alerts regarding healthcare or legal requirements. Right now with the COVID, destinations have different requirements. Some require a certain amount of insurance, testing before travel. They may have to do a quarantine. So all these things, as well as others, need to be communicated to patients in advance of their travel. And here, I think Karen is going to go into a little bit to our Well Hotel program right here. So I'll hand it over to you. Sure.
Well, I think as when you think of that care continuum, that slide that Bill showed twice, where it starts with service selection, and there's steps where the patient is seeking a destination, and a lot goes on before they arrive or are admitted to the hospital. And GHA Well Hotel really is committed to providing hotels with a comprehensive set of best practices. And we have Well Hotel for both medical travel patients and Well Hotel for those who are seeking well-being. And I think it's very important, and we've tried to build up some of the expectations that consumers have for a guest experience or a patient experience, and how linked the patient experience in a hospital, from the story that Bill just shared with us, is with respect to patient experience. Actually, a medical traveler spends more time in the hotel, and it seems very logical when you think of it. They might go ahead of time and stay in the hotel. Once they arrive in the country, they might have to have tests, laboratory, x-rays, MRIs. There might be several days before they are actually admitted to the hospital. And then they're there for the rehabilitation. And if they had bariatric surgery, they might have certain nutritional needs. If they had orthopedic surgery, they might have needs with respect to having handicap access rooms, or special needs with respect to transportation. If they had cosmetic surgery, they might really want to have more privacy than other guests in a hotel. And I mention these because what the Well Hotel for medical travel patients really seeks to do is to make sure that the hotel is aware of the medical travel patient. So they have a list of them. If there's an emergency, a fire or something like that, they are able to assist the guest out, so they know who needs help. And also that they are looking at not only their nutritional needs and their overall guest experience, but also that if they have special needs due to their medical or well-being status, that they are there to help them. So we are again, the only accrediting body that focuses on that entire continuum, whether it's wellness travel or medical travel. And we want to make sure that all of the various touch points, guest travel, guest stay at a hotel, stay at the hospital, that they are all with little risk and really are leveraged in order to provide a very, very good experience. Next slide. Bill also mentioned the issue of safety and how important it is, especially in this year, in this era of COVID, that consumers really want to make sure that they are being assured of safety and sanitation. And so GHA has partnered with the Global Biorisk Advisory Council, which is a division of the Worldwide Cleaning Industry Association, ISA, with respect to relying on their sanitation standards and cleaning standards. So GHA, our elements are looking at leadership, the guest experience, some of the things I just mentioned as far as nutrition, and if they're going for well-being, aspects related to the spa and the pool and exercise and meditation. But as far as the sanitation, if those hotels if they're not part of a big chain, or the national government is not necessarily providing them clear sanitation standards, they are relying on the GBAC star, which is the Global Biorisk star. And we have a joint accreditation where we have combined those elements. And so we are assuring them not only of a good guest experience, but also safety because of the sanitation. And that includes safety protocols, which I'll get into in a little bit. The program is all done virtually, so it's a remote survey, and it's an annual accreditation. There are certain foundational requirements, and this how many, the type of bed, the type of bathroom facilities. Usually it takes between 1 and 3 months preparation time, and they hotel would submit their documents. We have a list of required documents, and they would submit those online where they are reviewed, and then we would provide the accreditation. Now, certainly the safety issue is very important. And what we try to do is to make sure that our elements require that the hotel has established safety protocols throughout the hotel, not only for guests, but also for their staff in the kitchen as well. So there's cleanliness and certain standards that are recognized worldwide that have to be met. We provide assistance in supporting the cultural, dietary, religious, handicapped access, and certainly other unique needs of guests or patients who are staying at a well hotel. And again, we have certain standards if the well hotel is taking care of medical travel guests, and other standards if it's for well-being, and obviously would include, the spa requirements and the pool and certain other elements. We want to make sure that guests feel, very much a sense of peace of mind that proper cleaning is an ongoing priority of the hotel, that there are protocols in place to sustain that there's a trained team of staff educated to support the medical and wellness guest accommodation and recovery experience. For instance, with hotels that are serving medical travel guests, I had mentioned that, the hotel needs to maintain a roster. They also have to have an arrangement that is done ahead of time. I mean, obviously, hospitals usually are referring guests to various hotels, and that hotel then has like a backup emergency plan in the event that the patient's recovery is not as, it might not be going well in case of an emergency, that they don't have to take the time. Where do we need to take this patient? They know exactly, it's this hospital or this clinic, and they can make the call. So there's a kind of emergency plan backup that is already built into the program. We certainly want to exceed the needs of medical and wellness guests as they arrive at these hotels. And the accreditation process, as I mentioned, is conducted online. So again, we have specific standards for those hotels that are serving medical travel guests, as well as those hotels for well-being. And we certainly recognize that the GHA Well Hotel for Well-Being, these are hotels that are, treating guests who are not treating guests, but accepting guests who are looking for a healthy lifestyle. It might be a business traveler who wants to maintain a healthy diet, some exercise while they're on the road, and they're picking that hotel for that purpose. So it could be, guests who are seeking a hotel while they're traveling for business, or it might be guests who are seeking a well-being hotel, and that is part of one of the priorities of a person's vacation or stay at that resort. And then obviously some hotels would treat both. So the accreditation process, as I mentioned, the GHA Well Hotel, one could either rely on GBAC standards for sanitation and cleaning. However, some hotel chains have established their own standards, obviously, that each hotel within that chain would have to follow, and we would accept that as well. Or I know some countries such as Thailand have established certain standards that hotels have to, they call it safe sanitation, I believe, for Thailand. And so we recognize other, authoritative regulatory bodies that are requiring certain sanitation. But that is a critical element of the GHA Well Hotel in order to build that confidence and trust on the part of guests as they are planning their travel. There's an online application and payment. The hotel then receives accreditation materials, which includes virtual training, as you can see on the process chart. We would, once they have, submitted their application, they get an access to 2 to 3 hours of virtual training on the program elements, specifically what, the accreditation process consists of, and the hotel would submit requested documents that would be reviewed by GHA staff, and then an accreditation decision would be rendered. This is done remotely, so there is not the need for on-site review. Now, the GHA Well Hotel for Wellbeing, we have 18 elements or standards, and it's structured in a manner where specific requirements, as I mentioned, the 18 elements are stated in a frame box, and then we have guidance and interpretation below. We're trying to make everything as transparent as possible to hotels that are seeking this designation. And we also have, as I mentioned, the list of required documents that a hotel would have to submit. We're trying to be very focused and very transparent, so it's not a lot of ramp up of, what do we need to do in order to meet the requirements for accreditation. One is a leadership commitment that the leaders of the organization are committed to being a well hotel for medical travel or a well hotel for well-being, that that there's a hotel commitment statement that is displayed prominently, whether it's in the lobby, but an area that guests would certainly see that this is the commitment of the hotel to do this. We certainly, accreditation is always about, quality improvement and sustaining that improvement over time. So we do want to see within the hotel's overall quality improvement plan that there are some targets or objectives related to the hotel's well-being or medical travel guests. Conformity and compliance, this is how are they, what is their compliance program with respect to that? And risk management, we talk about touch points quite a lot in our presentation. And here it might be, okay, we might have a driver that the hotel sends to the hospital to pick up guests, on discharge, or to the airport picking up guests. So we want to make sure, does the driver have protocols, appropriate safety protocols, each touch point along the way. And so we emphasize the need for the hotel management and those who are involved with the well-being part of that they are really looking at all of their touch points with guests and mitigating risk ahead of time in order to enhance a very positive guest experience. So they would have goals and objectives of their program as well, because we want to see we want to help hotels see measurable improvements for investing in well-being, that they're getting very good satisfaction scores with respect to guest experience. Standard operating procedures are very important. This would be like for kitchen staff, as well as the staff, at the front desk, what they're doing with respect to safety. So all of the SOPs that a hotel implements in order to enhance the program. And cultural competency, what are their plans for making sure that and hotels usually do have, multicultural staff who speak many languages. So this is certainly not new to hotel essence of what being in a hotel means, but that they could provide language assistance as appropriate, and that the staff, especially in a well-being hotel, who might be providing services such as spa, meditation, physical exercises, that they have the competencies to do that. If they're providing nutritional counseling, that they have the credentials in order to do that. Financial transparency, we certainly want, again, that the hotel is very transparent. If there's a package being offered, that is very transparent to the guests, that they know exactly what is included, what is not included, that they understand the guest services that would be available to them, that marketing, communications, and information sharing has a lot of integrity. It's very honest. There's not exaggerations being made by the hotel, and that the physical environment itself is safe. If there's equipment or pool, or is there appropriate signage available? Are there, places for the risk of falling? Have they been identified or mitigated? That's what we mean by the elements with respect to physical environment. I mentioned the emergency planning and response. Do they have an emergency plan, and how will they take care of their guests? If they have contractors who are providing some of the work, have they trained the contractors with respect to the safety protocols, the standard operating protocols that they expect? For instance, they might contract out their drivers, or it might be, another organization, but they should provide the training, and they should make sure that they check on the implementation of those standard operating procedures and to make sure that they are maintaining and sustaining the safety protocols. Document management is just, the compilation of the policies, procedures, the standard operating procedures that we mentioned, and, how do they manage that within the hotel, and cleaning and sanitation protocols. Again, I mentioned that whether it's GBAC, whether it's another organization, regulatory organization standards that a hotel is implementing, we want to make sure that they are following that and there's evidence of that. So those are the 18 elements that are contained within the well-being hotel accreditation. Bill, I'll turn it over to you. Bill, I think your volume is not on.
Sorry about that. I had my mute on. So no, thank you, Karen. It's just a reminder, if you do have the audience, anyone has any questions, please do share them in that little, what Karen mentioned, there's a little area either on top, at the top or the bottom or somewhere on your screen that you can put in those questions at the end of the presentation. I know we were a little bit behind schedule with that technical issue we had, but just to continue some of the services, additional services that GHA is providing, this GHA certification for excellence in medical travel patient experience. So this is a certification. We talked a little bit about the accreditation program. This certification is for hospitals or clinics who do not have a clinical accreditation. So for that, I don't think I maybe mentioned with the accreditation, GHA accreditation, to accredit a hospital, they must have a national or international accreditation before we can accredit that facility. Since we do not, our main focus is on medical travel. We do not do, what you say, a deep dive into the clinical care aspect. So for organizations for hospitals or clinics do not have that accreditation, we do offer a certification for excellence, again, in medical travel patient experience. So this is a certification that focuses primarily on the patient experience and sustainable business processes here. Here's a little bit of information. It talks about the preparation period, eligibility requirements. It's a 3-year certification, and if anyone's interested, we're happy to. We will share again the video, and we're happy to respond with more details about the program. The certified medical travel professional. I think Liana may have mentioned possibly it earlier, and this we actually through the MTA, with our association with this program with the MTA, it was presented in Bulgaria in 2016. We do have this program now available for several years now online. So this is a 8-hour course that professionals, whether they're working in healthcare facilities, we have healthcare executives, physicians, staff working in international offices, and others, hospitality, travel agents, medical tourism facilitators or agents. This is applicable or maybe interested in, for those who want to really raise their level of knowledge of the industry, best practices, looking at different business models, looking at understanding the patient experience, facilitation of care, marketing, risk mitigation. So this is, again, an 8-hour online course where you would take an exam and then achieve the certification. There is online educational resources available that you can access after the certification. So this is available again online. Certification of conformance. This with the COVID-19 guidelines. So this is a certification GHA issued in July of this past year, and it's actually we've had a number of, forget the exact number, but I think we're probably getting close to 15, facilities, or at least in process, and probably 12, so that have been certified already. So these are based on COVID-19 guidelines, which are available on our website for free. So if you're interested in looking at the guidelines, please feel free to go to our website. They're pretty visible there. You can download those. So they were developed to assist medical travel programs. So these are specific to hospitals and clinics, though others, facilitators and others may, I think there's value as well if you're interested in reading those. To assist medical travel programs with operational protocols or practices and procedures as they increase operations or resume treating medical travel patients. So this is an online program. The facility would do an online application. There's a readiness assessment. They would submit the recommended documents, required documents to a portal. GHA would review those, and then we would have a validation call to render the decision. certification decision. You can see details on the pricing there, and as well as the benefits, really helping what we've been talking about earlier, helping to build confidence and trust for patients through traveling, and communication with patients, transparency, education and training of staff, and looking really at areas such as hotel accommodation, transportation. It's looking at all these areas. We're not talking about how to treat patients for COVID, but how to mitigate the risks during travel. So that's what this COVID certification is about. And here again, that what you've seen earlier, that medical travel care continuum. So just quickly, some of the areas, the phases, what we're looking at, what we talked about earlier, but this is relevant specifically to COVID. So what is an organization doing, in phase one, that service and destination selection, what are you communicating to patients who are planning to travel, about, do you have telehealth or telemedicine available? What safety protocols are established along the care continuum? What workforce strategies? What happens when the patient arrives? Is there quarantine? The use of personal protection equipment, maybe patient visitor companion guidelines that have changed, with sanitation and cleaning, just how you're educating the patient through your website, through your communication in advance. Then looking at the information sharing and planning, you're providing a detailed itinerary that really talks about also protocols for COVID-19 risks and things. Are you sharing a care plan for the patient? Are they aware if they do test positive on arrival for COVID-19, they may have to get treatment in a hospital, be quarantined. Are they aware that they're responsible for those financial implications of that? So really being transparent about all these details, the accommodation, and just looking at the hotels, what protocols they have in place, and some of the sanitation and cleaning, especially in work protocols, admissions and treatment in the facility, screening patients, sanitation again, the discharge, what fit to fly information, medical certificate, does it mention if they've had testing? So this is all related to the COVID and helping to mitigate the risk for patients, and helping, having that seal that shows you have these things in place, and building trust with patients. And to finalize here, just some of our GHA accredited and certified clients. You'll notice that, some big names here as well. Cleveland Clinic, Cedars-Sinai was recently accredited. We've been doing a remote survey during the pandemic. Since August, we started offering that. We've already had 3 organizations accredited through the remote survey process, and we have several more that are in process for reaccreditation or for first-time accreditation. And also here it shows some of the organizations that have been certified with the COVID certification. We have a number in Thailand, several organizations in Thailand, and also in Saudi Arabia, an organization in Mexico. So it's been, globally, we've had a lot of interest in this certification. Just briefly here, just a client that highlighted some of the value that GHA, and this is referring to GHA accreditation. This is a facility, Prince Sultan Cardiac Center, Al Hassa, in Eastern Province of Saudi Arabia, that went through accreditation a couple of years ago, and after the accreditation, they talked about what things changed through the GHA accreditation process, how they redesigned processes to the special needs of traveling patients and families. And here you can see kind of the different things on their website, key performance indicators, and really aligning them with medical travel needs. And so they were at a conference. They spoke about, we weren't aware of it. They mentioned, after getting GHA accredited, they have to, required by the government to do the Press-Ganey satisfaction survey. And after obtaining the GHA accreditation, several months later, they were ranked first and second place in patient satisfaction for outpatient and inpatient procedure services. So that was, really, for us, gratifying to hear the value the accreditation provided, and also increase in medical travel patient volume, significant increase. They started with a low volume, but they've definitely seen a lot of benefit from accreditation. So that's just one example. These are some strategic partnerships. We've really, especially over this last year, we've been really working on, obviously, not being able to travel, doing a lot of things remotely, but we have some of our partners you see on the left, including a custom assurance placement. This is an insurance for complications insurance for medical travel patients. There's very few, really not many of that type of insurance around. So this is a partnership we established with custom assurance. And so organizations, healthcare providers have access with a discount to this insurance, complications insurance, whether the patient can purchase it directly with a discount or the organization can embed it in their procedures. Other organizations, Saudi Anaya, which is an insurance company in Saudi Arabia, GBAC, Karen mentioned, our accreditation partners. We are working with several groups now in Thailand and the Malaysia Society for Quality and Health, with a joint accreditation organizations in Malaysia getting accredited by GHA, but having a surveyor from the Malaysia Society of Quality and Health combined with the GHA surveyor. Doing that also in Turkey and in India as well. And just lastly, just a few testimonials from our clients. And again, we'll share this with the presentation and the link to the video with you. So just our value, just summarizing, and really our goal is to enhance that patient and guest experience across that medical wellness travel care continuum, all these touch points, help improve the performance and effectiveness of whether it's your medical travel program, whether you're a hotel with a wellness or focused on medical travel guests, helping increase your organization's visibility. And really, I think the importance of having a third party, someone outside your organization to validate, you may be doing a lot of things well, but validate the quality of the services you're providing to medical or wellness travelers. So I want to thank everyone. We really, again, apologize for technical issue we had. Some of you, I think we appreciate your patience in staying on. We may have lost a few others, but we will be sending out the presentation later to everyone. So does anyone have any questions? Let me check it.
If you could, if you hover at the bottom where it says participants chat, share screen, or Q&A. So please write in any questions. We have just a few minutes. We would be happy to respond to any questions. And certainly thank Bill and Uliana for their presentation. And as Bill said, we really offer you our sincere apologies for the technical issues that occurred during the webinar. We will provide the copy of the recording of the webinar for your information, and we're happy to respond to any specific questions you might have. You could just send it to info@ghaccreditation.com, or certainly I think Uliana could also forward any questions if you feel comfortable, if that's easier for you, to talk to Uliana, who is our local representative in Bulgaria and throughout the region. So I don't see any questions. So we thank you for your patience. You really have been terrific to stay with us during that time. And again, thank you so much. We wish you to, good health, stay safe, and we hope that we can cooperate in the future, and we see good things, very good opportunities available in Bulgaria and Latvia. Thank you so much.
Thank you, everyone. Thank you.
Thank you.